started the charity wanting really just to help patients in some way, but didn't know how. And I met Dr. Sean Ellion, and he said to me that he had a vision to take chemotherapy closer to patients' homes. And I said, well, I have a vision to help with travelling. And we put the dream together, and he really inspired me.
She had unbounded enthusiasm, and it seemed like we could work together and make this happen.
I got involved really through friendship with Christine, and we were with her through all the traumatic times of David's illness and then his final death. And Christine was very determined to find something to help people with cancer. So she came up with this amazing idea: mobile chemotherapy.
So I came back here and said, okay, we need to raise 150,000 to build the world's first mobile chemotherapy unit, which we did. I'm very proud of that.
Fantastic, really, absolutely amazing. A totally different environment being on here. Like I said, we're more relaxed, the patients are more relaxed. They can have up to a 2-hour wait in the hospital, which doesn't happen here.
I mean, I've been coming for treatment a long time, and I've been coming on the bus for a long time, so that's great for me because it's long-term treatment, so I know that, you know, it's going to be short in terms of the time that I'm here. Staff are great, I know most of the staff now, so yeah, I really enjoy it.
It's completely unique in terms of being able to treat patients with chemotherapy closer to their home in a mobile facility. It's amazing.
The unit itself actually was such a benefit to us that it gave us 2 extra years together. Tony was probably the most amazing person I've ever met. He became ill very suddenly, and he went from being a very strong, capable man who always took charge of everything, to becoming very poorly very quickly. As usual, we got to Cheltenham Hospital for 7 o'clock in the morning because otherwise we couldn't park, which meant a 6 o'clock start for us. And this big unit arrived outside on the car park, and we were told that there was going to be the possibility of treatment being available for people in local areas, in rural areas, rather than them having to come into Cheltenham. So Tony actually volunteered and was one of the first 2 people to actually go onto the unit, and our lives changed dramatically. We were able to spend more time together and feel as though we had a life outside cancer.
And so the second one's been launched in Somerset now, and that's extremely exciting because that brings a whole new population to access the benefit of this.
Good morning, ladies and gentlemen. It's a great day for Hope for Tomorrow because it's the second unit that we managed to deliver, and it's really nice to know how much good and help these things are to people.
You ready? It's just about to fall. Yeah.
I must say, it's absolutely terrific. I mean, it's warm on a cold day, but I mean, look at the facilities and what it stands for and what it can do. If you've seen the people at the hospital waiting and they've had long trips and so on, you're convinced straight away. I mean, it really is quite aggravating for them. And to come along to this is so much nicer.
Bumble, that's my mum's nickname, and it's a very proud moment. She's somewhere up there laughing, but in the meantime, her memory will live on here, and she's helping other people. So it's wonderful.
I think this is a marvellous facility, and you know, it's thanks to the charity that this is available for patients. It has made a big difference. It's definitely helped an awful lot.
It'd be fantastic to see more MCUs rolled out across the country. There's another one in Somerset, and if it could be rolled out, you know, across England, it would be amazing.
I would like to see Hope for Tomorrow be able to make more of these or get more of these. I mean, because it isn't only just this area that matters, there's a whole country that matters.
I'd like to see this go nationwide. It would be a great opportunity to be able to bring care closer to home to all the residents living in the UK.
I think this should be available for all patients receiving NHS treatment. There are lots of parts of the country where patients are either travelling extremely long distances, or public transport or their own transport is tricky. We all know how difficult the roads can be, so it would be unfair to deny any patient anywhere in the country this facility.
What the unit meant to me was that during that awful time in my son's life, as awful as it was, there was laughter, there was friendship, there was one-to-one attention.
I'd love to see one in every county. I just feel, listening to patient stories, that's my dream now.